So you'll hold the baby like this. 1, check if there's anything coming out. 2, then I do 1, 2, 3, and up. So push in and up, in and up, in and up. Again, pinch the nose, extend the neck, blow into the lungs. Make sure the chest is rising. So 1, 2, 3.
While it takes 6 minutes to lose or save a child's life, do we know what to do in case a child under our care burns, chokes, falls, or is just in some sort of an accident? What will you do in such a situation, or how do you respond in such a scenario? Today we are looking at pediatric first aid, and as I said earlier, the first 6 minutes are very crucial. Thank you for making time. My name is Aida Munzatsi, and Health Nuggets starts now. Pediatric first aid is the immediate care given to a child or infant who has become injured or who has become ill prior to the arrival of qualified medical assistance. Worldwide, more than 600,000 children, which amounts to 20% of children under the age of 15, are killed by unintentional injuries, most road traffic injuries, drowning, burns, falls, chokes, and poisoning. The aim of a pediatric first aid or any other first aid is to preserve life, prevent worsening of an injury, promote recovery, and relieve pain. With basic first aid knowledge, you could be the difference in a life-threatening scenario. To advance, we will have a pediatrician's opinion that is going to complement our ability to perform first aid.
And the purpose why we need to know about first aid is because, number one, of course, you can save your child's life. Number two, of course, you can save somebody else's life or even somebody else's child's life. And number three is you can prevent an injury actually becoming worse. And those are really critical and crucial moments. Like you clearly explained last week, the first 6 minutes are really critical. So those are critically the most important things that we need to know. Have the confidence, have the knowledge, so that you can be able to undertake first aid confidently. You can be able to be sure that you're doing the correct thing and not even worsening somebody's life. So the first thing that always happens in first aid is that you first of all have to, as a parent and you're taking care of your child, first of all look at the environmental situation around you. Is the child in a fire? Is the child in maybe drowning? Those are critical things that you have to assess, because you don't want to have two victims. So ensure that you have a good environment. Number two, when an incident happens, you have to assess quickly. One of the most important things to assess is whether the child is responsive. So if the child has fallen, for example, just tap them around the shoulders here and call their name. Are they responding? If they are responding, then usually you can give them further instructions. If they are not responding, then now you get your senses and antennas kind of alert and start thinking. If you're alone, it's a different situation from when you have other people. If you have other people, you can immediately ask somebody else to get the emergency numbers ready in case you need to go to the hospital. So we say look, listen, and feel. So look at the chest. Is it rising? And that means, are they taking breath in and out? Are they taking breath in and out? Listen. You go immediately to the mouth of the baby and listen to see whether there's some breath that you can hear. And then you feel, just touch and see whether the chest is rising and all this. So that's the immediate do regarding the airway. If they are having something on their airway, we recommend that you don't do any blind sweeps. Like if you feel like something is blocking them, don't go and try and remove it. You may actually push that thing further and lodge it and actually now block. So last week I know you talked about choking. Those ones might be obvious because the patient may go into what we call the universal kind of choking position, where they start holding their neck. So here, for small babies, we advise that you do use gravity itself, put them in a position where the head is lower than for example, the knees, and then you give them those taps, and then give them the 5. If you don't manage to dislodge it, turn the other side, continue with the 5, and I think this was very, very, very well explained last week. So I don't want to go into much more detail about that. So that's, for example, choking. If it's something obvious which you can potentially see and be able to remove that, then it's fine. But do not go blindly trying to remove something. Then once you can see that the airway is clear in a way, then immediately go to the angle of the jaw and feel whether they can feel any pulsations. So we have talked about the airway, you check the breathing, and then you're checking whether there's circulation. If there's no circulation, then now you go to the issue, the things that we talked about last week about doing the resuscitation, which I do not want to go into much further because they were quite well explained. Then finally, if there are any medications to be administered, sometimes medications which you may need to administer, we recommend that it's for the parents who already are kind of know that the child, for example, if a child has fever and you have settled everything and the child is a bit settled, then you can give something like the rectal paracetamol from behind if it was a fever which was accompanying. Sometimes the people who have allergies, you can give them allergy medications like Piriton, but these are parents who already usually know. If they already have like asthma, then they sometimes have inhalers which you can actually be able to give them. So in terms of the do's, the first thing is, like I said, just to summarize it, because I've talked about a lot, make sure that you're in a safe environment, check if the child is responsive, and then decide whether you need to do resuscitation or no, or you don't need to do resuscitation. So regarding the don'ts, I think this is also one of the most important, because like I said, you want to save life, but you don't want to be in a position where you actually aggravate or make it worse. Common situations where the don'ts we talk about in resuscitation, I'll just give by example. For example, if a child faints, or anybody, whether it's a child or an adult, if they faint, that is a natural reaction of the body trying to bring circulation of the blood into the brain. But sometimes you commonly find that maybe the parent wants to lift the child up. So now by doing that, you're bringing the child's head up, and therefore the circulation of blood to the brain is less. So don't do that. Just leave the child. If they faint, put them down and elevate the legs so that it helps the blood to go back to the head. If they are having things like a seizure, which is like epilepsy, the common thing is that they'll fall down to the ground, they go into jerking movements, they start looking like they're biting their tongue and everything. One of the things that people do by mistake is try to restrain the person who is having fits, which is not, it doesn't help. Trying to put things in the mouth to be able to prevent them from biting, they can actually bite you. They might actually cause more injuries by doing that kind of thing. Things like if you have an injury, something has happened to the eye, we just advise you to wash the eye enough and then pad it. If it looks serious or you cannot assess it, then you take the child to the hospital. So do not try and do some very many maneuvers. I know there are so many grandma tales about how some things can be helped as a first aid, but some of those actually put the child in danger, like trying to apply different chemicals and all those kind of things. Nose bleeding, very common thing. In the past, people used to say, hold the nose and lie back. That is actually dangerous in the sense that you may inhale the blood that goes back, and that blood in anything in the lungs is kind of an irritant and can actually lead to infection, pneumonia, and actually lead to problems. So we still advise the parents to hold the nose and put this to lie facing forward and hold it for a very long time.
Now, for last week's episode, that is the first part of pediatric first aid. We looked at a number of first aids that you can do in case a child under your care chokes or takes poison. These are children below the age of 1 year, and also for those that are above 1 year. In case you missed, you can always find it on our social media handles. That is on Facebook and YouTube at CAC TV Kenya. Today we delve further, for we'll be looking at how to administer CPR and also first aid for fractures, burns, and drowning.
So you're better off training everyone who takes care of the babies. Could be at school, at home. You make sure that you can even ask that where you take the small babies to kindergarten, is a teacher trained on first aid, so that you'll be able to know even if I'll get the phone call or they run to this and this hospital, at least they're empowered to know what to do even as they rush to the health facility.
So we can do the practical part of it.
Okay. So I think we can start with the CPR. So the way you approach any unconscious child is that you'll make sure that the area is safe before you approach, so that you'll also say you'd also not be a casualty. So the area is safe. Then you can check on them if they are responding or not. So you can tap and call them, say, baby. So if they are not responding, you call for help. So I need help. Somebody can call the emergency service, or for us is the nearby ambulance. That's what you'll call. Then as somebody is going to call for help, then I can check the pulse. You said between the windpipe and the large muscle, you just slide your 2 fingers and check if they have any heartbeat. At the same time, you're checking if they have any sign of life, any movement, any breathing, any coughing. You see if they have any sign of life. If there is no pulse and there is no other sign of life, then you need to do chest compressions. Said you'll do 15 compressions, the lower half of the breastbone. So we 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And that's the speed, because you're aiming at 100 beats per minute. Like that Staying Alive song, it goes for 100 beats per minute, and that is usually the speed. So 14, 15, and you said it's a compression. It's you're aiming for a third. You're compressing up to a third, about 5 centimeters in. And you said you'll need to breathe for the person. If somebody is not breathing, you need to breathe for them. And you can do mouth to mouth, and especially if you have something to protect yourself, then you can put over their mouth, pinch the nose, extend the neck, blow in as you observe if there is chest rise. Then come back to 15 compression, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15. 2 breaths. So we are doing 15 compressions. 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15. Some international guidelines will say 30, but locally we teach also 15. 30 when you're alone, 15 if you have a team. So, but usually teach 15 locally. 5, 6, 7, 8, 10, 11, 12, 13, 14, 15. And do 2 breaths. So you'll continue doing that until help arrives. So, and then your assistant or the person you shouted for help, you always think there could be someone around, so you can call for help. And sometimes we have most of the help on our phone, so you can call for help on your phone as you start the first aid.
Mm-hmm. And now what if now the child regains consciousness?
So if they regain consciousness, we usually place them on a recovery position. So you usually put them on the side. So this hand goes here. So it can be easy. Let me turn the baby on that side so that people can be able to see how the baby. So usually lie them on the side. This one is a bit stiff. So usually put them on the side, lying on their arm, and then. So we call it a recovery position, and it's a comfortable position. They can be able to breathe easily, and if there's anything flowing from the mouth, it can easily flow. They're able to breathe as they wait for the help to arrive. Yeah, so that's there. You put the baby on the side with the one hand supporting the head, so then they're able to observe that they are breathing comfortably. So the same sequence you'll do on a small baby, but you'll blow less air. You'll not
Maybe you can
overblow.
just do that.
Okay.
Right.
So again, the baby who became unresponsive, you will, a small infant, you will, again, the lower half of the, after checking their babies, because they have a short neck, you usually check the pulse on the inside of the upper arm, check their pulse, as you check if they have any sign of life. So if they don't have any sign of life, you'll use your 2 fingers, still on the center, on the breastbone, the lower part of it, but avoiding getting into the tip and the stomach. Then you do 15 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15. Then again, still do 2 breaths. For the small babies, you can cover, your mouth can cover the nose and the mouth and blow into their lungs and do 15 compressions again. 2, 3, 4, 5, 6, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 1, 2, 3, 4, 5, 6, 8, 9, 10, 11, 12, 13, 14, 15. Just using 2 fingers, then you blow. Yeah, so you need air into the lungs if the baby is not breathing. So, yeah, so you'll continue changing that until help arrives, or even if you're on your way to the hospital, you'll continue doing that until you get to the hospital.
But in case you don't have a face shield, you can do without the face shield.
You can do without. If it's your own baby, you can do without it.
Okay.
Yeah, or you can even get any other plastic bag and make a small slit and blow through it.
Okay.
So even in the hospital, the same is done, but in the hospital we use such gadget to breathe for the person. So instead of using the mouth, we use such gadget. We call it a bag valve device, and it offers the same function. Yeah. So instead of using your mouth, you'll use such a gadget. Okay. Called a bag valve mask device, and this is the work it does. So the next one is going to demonstrate how to apply a splint, and if you have a fracture of one of the lower bones of the leg. And so we said the idea is to make sure that there is minimal movement on the fractured part. So minimizing the movement is the main idea. So you can use, you can even use all the bandages. We have like 3 bandages. Okay. So you are going to use the 3 bandages, and we're assuming this person has a fracture around the chin bones and the lower part of the leg. So you said immobilizing the fracture is the main thing. Make sure there is no movement. Okay. So you said you'll get something tough, like a piece of wood. Make sure it's not so rough. Sometimes if it's so rough, you can wrap some bandage over it to make a bit more to make it more less. Doesn't hurt the skin of the person. So you've put the leg in quite a comfortable place. So I'll need help. So with your help, and I can also ask you to slightly slide the bandage as I minimize the movement. Okay. and another one. You can even set the 3 of them and we slide them below. So I lift the leg. So I can do one above the knee. So just to make sure that I reduce the movement, because the knee is a joint, the ankle is a joint. So I can make sure that I'm able to put my bandages. So you can do a simple knot, usually like the one the scout called a reef knot.
How tight is it supposed to be?
Not too tight, just snugly, so that if it's too tight, you can also cause pressure injury to someone's skin. So that's why I said you can even put a padding to make sure that you're not having direct pressure on you. The hard material that you're using doesn't cause direct pressure, which can cause pressure injury. So you'll put these knots, and they are called leaf knots, so that they'll be easy to remove. So usually along the side, okay, so that they'll be easy to remove. Okay. Okay, so this make sure that there's minimal movement to the part which has a fracture, and even as you move them into a stretcher or even into any other transport media, they'll be able to transport means they'll be able to stay like this with minimizing the movement. And then you can keep checking, especially you can keep checking if the toes are turning white, then it could mean your bandages could be too tight. Then you can loosen and check if there is circulation to the so that you not lose someone's leg. You can check if there is circulation into their leg. So if it turns too white or too dark, then you know there's a problem. Then you can loosen it up.
Okay. Does the same apply to the falling, the hands?
Yes. And if it's just a dislocation, you may just need to do a sling. So you if there's a fracture, then you really need to put some form of immobilization for the fractured bone. Okay. So even if it's the hip which is fractured, the key idea is to tie it that there is no movement. There's minimal movement. You can even use a bed sheet and tie it around the hip to make sure that there is minimal movement. The more you move a fracture, the more injury you're causing and the more pain for the person. Okay. And even if the bone is protruding out of the skin, the concept is the same. Put it the most comfortable place, then immobilize, and you can even do a dressing on the part of the broken skin.
The precautions at home. First of all, we don't want to enter into these situations where we're having to save somebody, and we know that prevention is the best medicine. So the way to prevent this, number one, is educate children about safety. So make sure that as a parent, the children know what are the safety rules, for example, in the house. So, for example, you tell them that they should not be playing with electrical devices, putting things into, or touching things like where the plugs are going in. For example, the accidents do happen a lot in the kitchen. So when you're in the kitchen cooking and all this, minimize the children being there really, unless they really need to be there. Because commonly, children will go to, if something is cooking in the fire, they might just go and hold it, innocently thinking that it's not hot, and they end up having a lot of burns coming from this. So educating the children about the rules. For example, the toys in the house, sometimes they're the causes of falls and slips. Things like if you're living in a place where there are stairs, children sometimes like to hop, and it's a fun game for the children to jump on the stairs. And some of these are things which can actually lead the child to slipping. So things like climbing into, if there's a rail in the house, you make sure that the children understand that they should not be climbing onto those rails. So the children should actually be taught very early about this. But you yourself also should make sure that you try to make the home safe. And sometimes there's some things like there are sharp corners. That is where sometimes children bang into their head and have deep cuts. Things like rails, sometimes putting just a barrier. Things like putting, like sometimes avoiding just these clothes where the children can pull. Because sometimes somebody can put something like a TV on top of a cloth, which is slippery, and the child just pulls that. And don't underestimate how much children can pull at things, and actually things fall on them. So putting all these safety measures in the house will actually help you to minimize this. And sometimes some children actually who have conditions where they do have risks of bleeding, like for example hemophilia, and their extra measures are needed. So just by training your kids, safety rules, keeping your house safe. Then number 3 is supervision. You should always be supervising your children. Don't leave them unattended. And the dangers, particularly in swimming, if you're going to swim, then they need to know where they're swimming. You must have a lifeguard, or if you don't have a lifeguard, they're swimming in a place where it is shallow water only, and not just running around, for example, the swimming pool. Those are where commonly accidents happen. So we need to, so just in brief, just to have safety rules, train the children, supervise them, and keep the house safe. And all these things together will minimize your chance of being of entering situations where you actually now have to do first aid measures. But there are some situations where we can't avoid this. For example, children who are epileptic, children who have got asthma, those ones sometimes they happen suddenly, and that is where you need to have a prior plan. Then in advance, always try to know, if supposing something happens in my house, where am I going to take this child? Because first aid measures are not always complete, and sometimes situations have to reach hospital. For example, children, let's say epilepsy, but children sometimes have fevers and then get fits, what we call febrile convulsions. Those mothers also should become aware, and sometimes actually if it happens a second time and you are aware about the situation, you're able to control that and be able to prevent yourself going to hospital. So those are the key things that I would advise regarding that. Then finally, always have a first aid kit in the house. First aid kit can be a box, it can just be components of it. I know boxes may cost money, and not everybody may necessarily afford to buy the way it is packaged, but there are many organizations which actually do the job for you, and they are sold in the supermarkets, and you can buy that. But if you don't have that, at least have in your a collection of items. Have scissors, have cotton wool, bandage, have elastoplast, have something that you can wrap around, something you can hold as a sling in case that you have this happening. Some few basic medications like the rectal paracetamol, which is medicine you put from behind, that is paracetamol to reduce temperature. If you know that you're asthmatic, have that inhaler in your toolkit. And these ones keep away, because unfortunately, these incidences are not always so common. So sometimes people forget and say, oh, I have a scissors there, let me just pull it out. I do something else. I have something, I got an injury. And then you don't replace whatever is there. Then the day it happens, then you realize, oh, I can't get this. So you're keeping around trying to run. You don't know the number. And even children, by there, you can train them on first aid. So it's not just the adults who need to know, but even the children themselves can know what first aid to do. And many children actually can understand, if somebody is bleeding, I can just need to tie this. But you need to have clean things, for example, to tie, so that you don't get infection. So I would recommend that at least all those things put together will be able to make our homes safer, to make the parents more confident to be able to do first aid. I think first aid can overwhelm you in terms of so many things that you need to do, but know the basic things. Choking, how will I do that? Things like at least anything to do with the breathing, that is very critical, because the oxygen to the brain takes a very short time for you to lose a child or to make things worse. There are some skills also you need to just teach the children. I talked about teaching them about first aid, but also teach children how to swim. It is a very good thing. It prevents a lot of things like drowning. It's good physically, it's an activity, but also prevents them from drowning. So if you can teach your children how to swim, why not do so? So you don't want to enter these situations when the thing is actually happening. I mean, the first time the thing is happening is when you are actually now trying to practice this. So there are training courses for first aid. I know they may cost money, but if they are costing money, there are other resources actually which are available out there in the internet, on YouTube. Try to get the correct resources. There are many places which are trying, including your show, Ida, I love this, is trying to educate parents about first aid so that they should practice the tapping of from the back. Practice just hyperextending the neck. Practice all these things in advance so that when these things actually happen, the situation actually arises, it is not the first time that you're actually trying to do this. You're already kind of confident, oh, I know this, I know my doctor's number is this, I know if this is what I call by response, I just tap the patient. So we normally rehearse all these safety things for other things, so this is even more important for your child. Just rehearse in advance, know that this can happen. And not only may you save your child, but you may save somebody else's child. You may even save an adult. So that is all that I need to say for now. Yeah.
With basic first aid knowledge, you could be the difference in a life-threatening situation. For awareness saves life. Thank you for keeping it Health Nuggets. My name is Ida Munzati, and special thanks to Code Blue Training Limited and the National Nurses Association of Kenya. For any questions and comments, you can always reach us on our social media handles as displayed down below on your screen. And as always, your health matters.